Good afternoon, everyone. Welcome to today's Learning and Families Committee. I'd just like to welcome a couple of people who are not normally here. Steve Sweeney, first of all, thanks for coming along. We have a paper about your very important work shortly, so it's appreciated you being here. And also to Mr. Robert Stubbs, who's attending as secondary school parent rep. And it's nice to see you. I know you've probably come down a bit as well, so thanks for coming. Without further ado, though, we will move on to welcome and apologies and substitutes, please, Wallace.
Good afternoon. Thank you, convener. We have one substitution this afternoon. Councillor Anderson is substituting for Councillor Freshwater. Yeah, that's it.
Thank you, Wallace. Do we need to do a roll call of those online? We're all right. Yeah. No, that's grand. Thank you very much. We'll trust that everybody who's meant to be here is online. In terms of the minutes, there are 4 lots of minutes there for agreeing. Can we, Councillor Barrett, you have a question on joint GNCT minutes?
Yes, I just wanted to ask about the reference to the mobile phones policy, if we could have an update about what's happening on that. Thank you.
David, please.
Yes, Councillor Barrett, I'm actually meeting with staff at schools this afternoon to begin to map out the consultative exercise round about creation of a PKC mobile phone policy that's kind of commensurate with the Scottish Government guidance and where we actually are at the moment as well. So that will continue throughout term 2, and as I think the strategic leader said, there'll be a paper brought to this committee, I think in February or March of 2025.
Thank you, David. Thank you, Councillor Barrett. Any other questions on the minutes, or can we agree them? Thank you very much. Item 4 is the outstanding business statement. Have we any questions on the outstanding business statement, or can we agree that as well? Thank you very much. We have a briefing note on the secondary sector teacher representative. Wallace, I don't know if you want to say anything about that.
Yeah, I can do a quick update. So following the conclusion of the elections for the process to identify a secondary rep for the schools, in which 2 candidates were nominated and put forward, Miss Laura Jane Grant from Blairgowrie High School was duly elected and received the majority of the votes. So the committee today is asked to formally agree the appointment of Ms. Grant as the secondary school teacher representative on the Learning and Families Committee as a non-voting member.
Thanks, Wallace. Can we formally agree that appointment? Thank you, everyone. Councillor Shires, apologies. You have a comment to make. I think it's a declaration of interest.
Thanks, convener. It was just given the paper on youth work strategy, I just thought it was appropriate to mention that I'm a trustee of Skid and Blairgowrie. Thank you.
Noted. Thank you very much. We'll move on to the first substantive paper of the afternoon, which is a very important one, Suicide Prevention Update August, and it will be introduced by Sheena Devlin. Thank you.
Thank you, convener. I welcome the opportunity to introduce this report, which is an update on the suicide prevention work following the report which previously went to this committee in May 2023. This can be a difficult subject matter for so many of us to contemplate, and it is one, therefore, that, as this paper makes clear, requires ongoing activity and responsiveness. The update paper demonstrates the breadth of work undertaken to address what is a concerning area of risk impacting young people across the whole of the United Kingdom. Through our investment in this area of work, we have accomplished our short-term outcomes and are on course to address medium to longer-term objectives also. Much of the work is focused on increasing our staff confidence and their capacity to provide proactive support at every level of need. And we do this by having a focus on quality everyday interactions and aiming to reduce the stigma of suicide and mental health through encouraging open and honest conversations. The work as described in this report will continue, and our partnerships will be fundamental to keep driving forward improvement to ensure that our children and young people are as safe as they possibly can be. The work has been and will continue to be reported via the Children, Young People and Families Partnership on an ongoing basis. Pleased that Susie Turner, our Principal Educational Psychologist, and Steve Sweeney, our Suicide Prevention Coordinator, are here today to help with any questions that committee may have. Thank you, Convener.
Thanks, Sheila. I'm going to pass on to Councillor Frampton at this point. I should have done that a couple of minutes ago with apologies myself. So if you can invite questions, that would be appreciated. Thank you.
If there's any questions, can you? Delia Hearn.
Thank you very much, and I really welcome this paper. This is a subject close to my heart for personal reasons. I think it's a well-written report, well needed. My only question is the fact on paragraph 2.1, it says it will note the contents of the report and report to the Children and Young People and Families Partnership. We're not all on that, and I would like to see a report come back to this committee, not necessarily every committee, but at least once a year, if that's possible.
Sorry, Michelle, I think, to be fair, the minutes from that committee usually come to, I think.
I understand the minutes might come, but it doesn't give us a chance to discuss it. All we'll see is that it went to that committee. I welcome the chance to discuss it in this committee if necessary.
No, noted. Thank you. Good point, Billy. Thanks, Mr.
Provost.
Thank you, Vice Convener. I'm wondering if we could get an update on the current waiting times for CAMHS in Perth and Kinross, which is obviously quite a critical issue in terms of there has been significant wait times I'm aware of in the past, and it would be good to understand where we currently sit and plans to reduce the waiting time that young people are having to wait to access that service.
Thank you, Provost. The actual data in relation to that we wouldn't have right here and now. Our health colleagues would have that, so we can ask for that to be circulated to all members of the committee thereafter. Susie, do you want to give any update in relation to that? But I'm thinking that we currently don't have that information. No, Susie's shaking her. We don't have that information with us today, but we will endeavour to get that for you and be sure to share that with everybody.
Thank you, and if we could have the actual numbers noted in the minutes as well, just for the record, that'd be helpful. Thank you.
Councillor Stewart.
Thank you, Vice Convener. At the recent Integrated Joint Board, we had an update about some of the strategic work that Perth and Kinross Council and NHS Tayside are doing. And I noted there was work around personality disorders. And we know that personality disorders can come from childhood traumas. And in the paper and the subsequent appendix, we hear there's a lot of liaison work and coordination, and I'm wondering if there's part of the children's team are working with other members within the. I think there's work with Dr. Kirsty Gillings going on, if that sort of coordinates with the children work.
Thank you, Councillor Grant. I think, Susie, it would be helpful, and Steve perhaps, just to share an overview of some of the work that we do in relation to Dr. Bray and the whole team at NHS Tayside, and of course the connections that you have, Steve, with your counterpart in adult services as well. So perhaps that would be helpful just to get a very brief summary of that kind of partnership work that's underway. Thank you.
Okay, so I can't really comment on personality disorders per se in terms of how that's diagnosed, other than that, yes, I think it can be really related to traumatic experiences early on. We work closely with our health colleagues to make sure that all the adversities that children and young people face are dealt with within a framework of GIRFIC, and that we're all very interested in working together collaboratively to make sure that we provide the right intervention at the right time. So the whole protective environment in terms of what's going on for any individual child is taken at the soonest opportunity. We work very hard to make sure that information held by health professionals is shared with the named person at the soonest opportunity. And we've been working hard to work our way around issues such as confidentiality, which can complex the issues involved. But there is real commitment to make sure that that happens. And we're very lucky in that we've got a supportive colleague in the public health. So that is Dr. Jane Bray, who leads the Tayside Public Health. And I've got a very close working relationship with her, and we communicate on a weekly basis about these sorts of issues.
Councillor Duff.
Thank you, Vice Convener. My question is in relation to section 2.2 of the report, which I think is on page 37. It's to do with information sharing, principally, I think, between ourselves and the health service whenever there is a self-harming or suicide-related incident that happens. And I just wondered how that information sharing was going, if it was working well, and also whether parents were made aware when that information is shared. Thank you.
Steve.
Yes, thanks for that. So far, the information tells us that the work is going well. There are many moving parts involved in the system, particularly to do with health. When you're thinking about primary care GPs, accident emergency, you've got the PRI, you've got 9 Wells, you've got CarsView, you've got the ambulance service, school health nurses, paediatric services. So it's quite a system to engage with to make sure that all the parts are working seamlessly together. But early signs are that it is going well. We're committed to an evaluation which is taking place right now, October, November, where we would reconvene and look to address any anomalies in the system. But there, it's taken a while to get to this stage, but there is, again, real commitment from health colleagues to work closely with the named person service. Parents will be informed, because what we're asking is that parents and children who require medical information are asked directly whether they would consent to the information being shared with the named person. So parents are involved at the very first point of contact. I hope that answers your question.
Just a quick follow-up then. Does that mean that the parents can refuse to share, ask for that information to be shared? Thank you.
It centres around the child's permission initially, and if they're of an age to consent, then that will be deemed permissible. If they're not of an age, then the parents' views will be taken into account. The whole family's views in terms of parent and children relationship would be taken into account. But there is a threshold, obviously, in terms of child protection, where then if the child protection thresholds were met, then information would be shared as a matter of course within that context. And we would always, if information wasn't consented to be shared and the named persons found out that there had been an admission to hospital, then they would exercise their role as they normally would in that context, and we would always work towards collaboration with the family.
Thank you. Councillor Stewart.
Thank you, Vice Convener. Thinking about staff, we heard in the report that an increasing number of guidance staff are being trained to help with this process and other staff members. Is that going to be an ongoing mandatory part of the job?
And we would use the term encouraging and working with people who are willing to be trained and to upskill. And we find that is the case, that staff are very keen to access the training that's on offer. What we've been able to offer is a very structured approach so that the training that they receive is in keeping with the role that they have. And we are committed long term to ensuring that there's staff who haven't accessed training access it to 100%. So we're aiming that all guidance teachers and staff working in support roles will have access to assist training, for example. And we expect, in the same way that the Scottish Government expects the whole of the workforce to be informed with trauma-informed practice, we would expect the same in relation to suicide prevention work, so that the whole school understands the mental health situation that is there for kids. Okay.
Thank you. Councillor Shires.
Thank you, Vice Convener. My question's around in the tail end of the report talks about resource implications, and that we obviously understand that the funding for this, the coordinator post, ends at the end of this financial year. And I suppose my question is quite a general one about the funding for, we've recognised the importance of this. Councillor Provost McDade asked the question about the CAMHS waiting list, and we know that the pressures that's on funding. So what representation has been made to the Scottish Government about the work that's being done and the need to keep the money flowing in order that it can keep going and developing?
Convener.
Yes, that's a really good point, and without going into too much detail, I think you can be rest assured that we take this very seriously. So, representations have already been made, let's just say, in the strongest possible terms, that we need to keep this post going as an administration as well, aside from Scottish Government, notwithstanding the fiscal challenges we face, and without making any pre-BRG budget promises. Let's just say we know how important this is. I think that's what I want to say at this point.
Thank you.
Councillor Ahern.
Thanks very much. My question is a follow-up from the answer and question that Councillor Stewart just asked about the assist training. As somebody that's done the assist training, it's not a subject matter and an ability that a lot of people, or some people, might not be able to cope with that subject matter. So I don't think it should be mandatory, and I think it has to be allowed to be the individual that accepts that challenge to do the training. Thank you.
And I think when Steve answered, he said it's about, people are encouraged, and those who see that they are able to do it will come along. But you're absolutely right, it might not be appropriate for absolutely every member of staff to do, and we wouldn't be seeking to have every member of staff. But when people recognise the value and the import of it, then we're not short in having people coming along to that kind of training session. Absolutely, thank you.
Thank you, Sheena. I don't see any more questions in the box, so I'm just going to move this paper. Sorry, Councillor Duff.
My apologies, Vice Convener. I just sneaked in at the end. I was interested. There's a paragraph at the bottom of page 38, which says initial findings suggest there will be numbers of children and young people yet to be determined with tier level 3 needs being referred to tier level 2 services. And I just wondered why that might be the case. Is there some kind of shortcoming in the assessment, or is it to do with a shortage of tier 3 resources, or is there some kind of explanation for that comment? Thank you.
Steve, please.
Yes, thank you. So this really is in recognition that for those children who have a number and range of adverse childhood experiences, the accumulative impact of that can be quite far-reaching, and the best efforts of the named person service to match a service to meet those needs, that area of work needs to be closely scrutinised, because what we've been seeing is that with the availability, for example, of counselling being made available in schools, there may be referrals made to that particular service, which is a tier 2 level service, and may not accurately meet the need of that individual child, whom you could say has a tier level 3 need. So this is about understanding the system, where children and young people are at in the system, and what is the functioning of our system and its capacity to analyse the situation and make sure that children get the right support from the right service at the right time. So it's really about making sure that the right referral is made, and so children's experience isn't that they're perhaps referred to a counselling service that may not be skilled enough to deal with the deep-seated trauma that exists in their lives, and then having to refer on to another service such as CAMHS. We do have tier 3 level services in Perth. We've got the Lighthouse service, we've got RASAC, we've got the Family Change service, and we have Tayside CAMHS. But we would prefer to know where each child is in our system, so that we know that they're getting the best possible support that they can. And so that there's just work in this area that we're developing at the moment.
Yes, so to pick up from that, I think this will be quite a long-term piece of work in terms of answering some of the questions that you've articulated, Councillor Duff. And it is about how we best organise our services, not just within education and learning, and not just within the council, but with all of our partnerships. And so that's the area of work that we will be taking forward. Thank you.
Thank you, Steve and Susie. No more questions, so I'm just going to formally move this paper. This updated paper represents system-wide work in a challenging area. The work includes a focus on everyday relationships, along with ensuring structures and processes to provide frameworks for managing risk. It is clear that these frameworks rely on effective partnership working. This is rightly an area of ongoing activity and will continue to be reported into the Children, Young People and Families Planning Partnership going forward. I'd like to ask the convener to second the paper.
Thanks, Vice Convener. There are no words that I can find that adequately describes the importance of the work you do, so I'm not going to even try. I would, however, like you to accept our thanks for the work that you're doing, and anybody else that you're involved with. If you can pass on our thanks, that would be really appreciated. We just know how important it is, so I'm happy to formally second. Thank you.
A comment from Councillor Barrett.
Thank you, Vice Convener. I'd just like to add my thanks to everybody involved in this. I warmly welcome the progress that's been made since Steve Sweeney was appointed as Suicide Prevention and Mental Health Coordinator, including the whole system approach being adopted to supporting staff and pupils and their families, the Perth and Kinross Suicide Prevention Steering Group to liaise across services for adults and children and young people, and the working with partners like the Lighthouse. And I just would particularly like to thank Steve and Susie Turner for this and all of their teams. Thank you.
Provost.
Thank you, Vice Convener. I think we're absolutely heading in the right direction with this approach, and very supportive of the work that's being done. I am, as I expressed earlier, concerned about the waiting times for CAMHS, and particularly the fact that early access to CAMHS can help prevent further escalation and prevent families ending up in crisis, as well as the young people ending up in crisis. So I think that's something that obviously we need to work with our colleagues in NHS Tayside to ensure that those waiting times do come down, because they are too long at the moment. And hopefully, as part of this wider piece of work, where we're taking a whole system approach, that can be achieved.
Thank you, Councillor Shire.
Thank you. Just to echo the comments that others have made, but also to offer Bailey Ahern some reassurance that at the Children, Young People and Families Partnership, and you'll appreciate this, Vice Convener, there is that opportunity to really delve into the practice and with professionals from partners, NHS Tayside and others around the table. It's really valuable, and perhaps there's a piece of work for us who sit on the partnership as elected members to report back to our colleagues in more detail about the discussions that take place, which are not reflected necessarily in the minutes, but just to offer that reassurance, and look forward to those ongoing discussions. Thank you.
Thank you. Can we agree the paper? And I'll hand back to convener now.
Thanks very much, Vice Convener. Just before I move on to paper 7, it's a good point that Councillor Shire's make. It's one of these things that, in the nicest possible way, I've delegated to Vice Convener Frampton, because I know she's really passionate about the work and she keeps me informed. So thank you to Councillor Frampton, and indeed to yourself, Councillor Shires, for the work that you, and Councillor Barrett as well, of course, with apologies for your work on this committee. It is appreciated. We'll move on to paper 7 now, though, which is the Scottish Attainment Challenge funding update. Who doesn't like a bit of PEF? And I'll ask Sheila to introduce it, please.
Thank you again, Convener. I'm pleased to introduce the Scottish Attainment Challenge Annual Funding Report for 23-24. In previous years, this will have come as a pupil equity, a PEF funding report, and that has been brought to this committee to provide an update on how this important funding stream is being used by schools to address inequality and improve outcomes for children and young people impacted by poverty, with a focus on tackling the poverty-related attainment gap. It is now a requirement that all 3 funding streams that now exist within the Scottish Attainment Challenge Fund, encompassed by this whole fund, so that is Strategic Equity Funding, SEF, Care Experience Children and Young People Funding, and Pupil Equity Funding, that an end-of-year report is submitted to the Scottish Government summarising the interventions implemented during the course of the year, along with evidence of their impact. It should also include any qualitative and quantitative data relating to the impact of the funding. This overarching report fulfills that new requirement, combining those 3 funding streams and providing an update on the progress that has been made in Perth and Kinross during 23-24. The report evidences steady progress over time in closing the poverty-related attainment gap. However, there are still significant differences in outcomes between those from our most and our least deprived communities, and between children and young people with care experience and their peers. The report also details the breadth of the Scottish Attainment Challenge funded approaches which are being implemented, tracked and monitored to improve outcomes for children and young people at every stage. The case studies included demonstrate some of the specific impacts for each of the funding streams. Arn Singh from Children, Families and Justice Services, myself and other service manager colleagues from across education and learning are here to take any questions that committee may have. Thank you.
Thanks, Sheila. Any questions, please? Councillor McPherson.
Thank you, Convener. It's just a clarification of a possible anomaly there on page 65. It says regarding the pupil equity funding, it says 78 schools in Perth and Kinross received funding. I just note that from the table below, the total actually comes to 81. I just wondered what that sort of difference of 3 can be accounted.
David, thanks.
So yes, I think that difference is because of the number of all-through schools that we have, and those will receive pupil equity funding for the primary department and the secondary department, but there'll be separate allocations. But I'll ensure that's in fact the case.
Thanks, David. Any further questions? No, if there are, Caroline, Councillor Shires.
Thanks, Convener. I was interested throughout the report. It refers a lot more than in previous reports to the data and the tracking of the data, and I thought the case studies were really interesting. It was at 4.13. It refers to a bespoke tracking tool. I was to get a bit more detail around what that kind of looked like.
David McCluskey again, please.
Yes, Councillor Shires, you've maybe heard us talking before about the Closing the Gap tool, which is a bit of our in-house jargon, which we've tried to eliminate. So that's actually what we're talking about there. So that's been something we've been working on here for the last 3 to 4 years, and we've gradually been refining it there. And that allows us with far more certainty to actually pin the impact of improvement upon the intervention that's actually been used. So, and I think probably you've also reflected on that kind of confidence in data that's been reflected in the last 2 or 3 reports in particular, and that's certainly through the widespread adoption of this tool.
Thank you, David. Caroline?
It's maybe quite technical, so I may have been a bit daft on this one, but so
What is it?
What is it? What goes into it, and how do you then measure what's gone into it and what the outcomes are? I'm not really seeing what that looks like, because it's not. It's when you look at the case studies, it's not stuff. It's more than that.
David, thanks.
So the Closing the Gap tool, it's a tool. It's basically a spreadsheet-based engine that looks to identify the outcome that we're looking to achieve, and then isolate the factors of intervention around about that input that's PEF funded. From all other factors that are part of the kind of general education picture, if you like, that's happening for those children and young people. And then what it allows schools to do is identify the fidelity of that improvement being attributable to that particular intervention, because as you'll be aware, that's a really tricky thing to do, because you know it's a really holistic experience education, isn't it? So on the one hand, we're really trying to isolate the impact that this funding has given us, because we think that's really important. But on the other hand, an intervention is one thing, but the totality of the learning and teaching experience and the learning environment's another as well. So it's maybe not something we'd look to do all the time, but we recognise that it's really important in this funding. And you're right, it is really technical, and there's other people that are really technically minded in terms of producing and using that tool as well. And again, if there was any appetite, I'd be happy to share the detail of that at a future occasion.
Thanks, David. I think, Sheila, you might have an example for us, please.
David's absolutely right. In the early days of the PEF funding, there hadn't been that focus on ensuring that there was any kind of causal effect correlation between the monies that were provided and any differences that were seen in terms of either closing gaps, improving attainment, achievement generally. And so we were absolutely clear that we wanted schools to have clearer baseline data in any area that they were seeking to improve on. And so one practical example I can give would be around improvement in writing in primary schools. So it was pretty granular detail that we were asking schools to provide for each pupil within the cohort. Staff were then trained in very specific approaches and interventions, and they were used, David used the word with fidelity, absolutely with fidelity, and progress was actually monitored on a weekly basis to look at where the things that they had identified as needing to improve, one being teacher confidence in the teaching of and the evaluation of, and then the assessment of writing, were they improving, and did we have qualitative and quantitative data? And we did. And also what was really important was then the young people's experience around how they felt about themselves as young writers. And so that also became part of that. So that was all, you know, put into that system, so that what we were able to say was, we do believe that as a result of this money being spent on this intervention in these classes, in these schools, we have seen a tangible improvement in attainment in writing.
Thank you. Councillor Duff, please.
Thanks, Convener. I'm interested in, I think it's sections 3.3.3 and 4. It's to do with supporting attendance. And on that page 62, I think it is, there's a picture of a graph anyway, which shows that the S3 absence to be significantly worse than the other classes. And further down on page 64, there is a case study of the S3 Construction Academy at Perth High School and the programme that Robertson's Construction run for us. It also mentions the fact that S3 pupils have the lowest attendance across PKC, and I wondered why that might be, why S3 in particular stick out in relation to attendance. But also in relation to the programme, it looks to be very positive from what I've seen and read and heard of the pupils that take part in it. But I wondered if it has had a positive impact on their attendance at their other school lessons over and above the Construction Academy. Thank you.
Thanks, Councillor Duff. David, please.
So I think the first part of that question, Councillor Duff, was about the different patterns of attendance and absence, and specifically around about that S3 cohort. And indeed, you know, what you can see from the short bit of the data engine that is there is that's not a new issue for us here in Perth and Kinross. It's just been exacerbated in recent times. It's also part of the national picture as well, that S3 tends to be the year group where attendance has the biggest drop off, sometimes together with S4 in some particular localities. So that in itself isn't new, and I think it's not certainly new to this particular school. In this particular school, it was identified that attendance was a real issue, and along with attendance, there's usually other issues as well that young people are dealing with. So Construction Academy was a really positive partnership that was created, you know, through Robertson's and the school with the support of central officers for that cohort of 8 young people who were experiencing a range of challenges in their mainstream schooling. I think what was important for them was, for some young people, they have now decided that a career in construction is what's really important for them and positive moving ahead. I think a big part of the readiness for work that was part of that programme has had a positive spin-off in terms of young people's engagement with school in general, because, you know, they might have a feeling about, for example, turning up prepared and ready for school in uniform. When you're in a construction site, those messages are even sharper and sharper relief. And I suppose, you know, I'm speaking with a wee bit of personal experience, having visited the site myself and spoken to the young people one-to-one, together with the adults who are working with them. So it has been a really positive project for us, you know, and I think also, you know, something that we're looking to build upon in a range of other different kind of contexts moving ahead as part of our kind of developing the young workforce work. So the question, I think, would be, is that having a positive effect in the attendance of these young people? Yes. It's having a positive effect beyond that as well, and it's probably done something for those young people, certainly for some of them, to really help cement their future career paths and goals.
Thank you. Councillor Massey, please.
Thank you, Convener. My question is on the PEF, and I'd really like to know how valuable the PEF funding is with regards to the number of pupil support staff we have in our schools and nurseries.
David, please, again.
So you can obviously see in the paper that it's a major component of the funding picture here in Perth and Kinross Council, as indeed it is across Scotland, and it sits within that Scottish Attainment Challenge, which is, explained in full, hopefully, in this paper. So, of course, that's a valuable component. You know, the paper also is pretty clear about the proportion of staffing that's funded through PEF spend as well, and that is significant for us moving ahead. So, yeah, PEF and SAC challenge funding in general has been a really useful tool for us here in Perth and Kinross, particularly in that mission round about trying to close the poverty-related attainment gap. And I think, as Sheena said in her introduction, we can point to some success in that as well.
Sheena, you're going to add something, please?
Probably worthwhile to share with committee that, you know, PEF funding is grant funding and therefore is non-recurring. We know that it's available for the end, up to the end of this parliamentary term, and then we're unsure about what the situation will be thereafter. And given the number of staff who are employed by PEF funding, we will soon be asking schools to be given consideration to, if you like, what might the exit strategy be should that funding not continue, and therefore that we would need to manage and mitigate the impact of any changes in staffing thereafter. Thank you.
Thanks, Sheena. Councillor Ahern. Bailey Ahern, I should say.
Thank you very much, Convener. Now, my question is on the tables on page 57, and it's the one with the gap between Acorn 4.5 and Acorn 1 P1s, 4s and 7s. The third table, which is the gap between SIMD quarter 1 and quarter 5, leavers attaining one or more qualifications at SQF level 5 and 6. There's no data for 23-24.
David, I think you're required an action again, please.
Thanks, Billy Ahern. Because of the number crunching that's involved in gathering leaver data, we don't get that from our partners in Education Scotland and Scottish Government until next February. So unfortunately at this stage, while we can report on the performance of that cohort at year group level throughout both reports that you'll see today, the Raising Attainment report and this report as well, when we look at where the real impact is, which is about what's happening to those young people when they leave schools, we're not in a position to do that until the following February. So we won't have an idea about where we fully stand with that in a validated way until February 2025.
Thank you. Councillor McPherson, please.
Thank you, Convener. My question relates to page 68, where the health and well-being, as I know, it takes up almost a third of the PEF-funded interventions. I can see from the bar chart below there's some general headings there, and there's reference made in the case studies. But I was just wondering if there was more specific examples of the types of interventions that a school has taken in working with a child to improve their health and well-being. Thank you.
David, again, please. Thanks.
Yeah, thanks. So, you know, on page 68, you can see a range of the different kind of headings with which we have worked with young people in terms of PEF funded interventions. A lot of what is done round about health and well-being is round about working with young people in terms of, and children and young people in terms of, for example, their emotional readiness to learn. So, you know, there's a range of different programmes at different schools round about that. Our colleagues in the Educational Psychology Service help support a range of interventions round about that as well. And those are also part of the PEF funded spend. So the answer to that is probably simple and complex, in that there are actually a range of interventions, and it really depends upon the need that's expressed by that cohort of young people in any school at any particular time. But it focuses round about what you'd expect it to focus: emotional readiness to learn, the generalised health and well-being picture, and sometimes issues round about mental health and well-being, as well as resilience and restorative approaches as well at school level to ensure that those relationships are more positive moving ahead.
Thank you, everyone. And last question from Councillor Duff, please.
Thanks, Convener. My question is in relation to page 77 of the pack, and on that page it shows 5 tables regarding the achievement of curriculum for excellence levels in terms of a number of things like reading, writing, listening, etc. rather not alarmingly, but concerning, I suppose, is that in each of these tables we see that there is a general improvement in the performance of those that are not care experienced. But over the last year or two, there seems to be a general downturn in those in care experienced in each of these 5 areas on that page. And I just wondered if there was any explanation as to why that may be the case. Thank you.
Jill Dugan, please.
Firstly, the numbers of children and young people are relatively small in primary at those stages, and obviously the cohorts change over time, but that does still show, even with those numbers, that there is a downward trend around that, and that is an area of real focus. Some of that that David talked about before in terms of attendance, sometimes both are related, and it is a real area of focus that we are taking with all of our primary schools through quality improvement visits, through discussions with schools that, as part of our attainment tracking information. We're also looking at that very closely because as you say, there is a downward trend there regardless of the small numbers. We do have additional funding through the SAC funding for care experienced children and young people, and the Promise Improvement Lead is also taking a role in terms of supporting schools with the improvements in those areas as well, and the work of that has begun, and we'll continue to track that through our usual processes.
Thank you, Jill. Sheena?
Just to pick up on that point about the Promise Improvement Lead, I guess there's a couple of things to say in relation to that. What we also know is that for our looked after young people who are looked after away from home, they tend to do better than those young people who are looked after at home. So we have quite a different approach depending on the cohort. We do need to remember that, as Jill said, the cohort's not static and it's small numbers generally. However, we have recognised in previous reports, Councillor Duff, that there is still significant work to do there, and so there has been investment in what we've called the Promise Improvement Lead. That's an experienced officer who's previously worked in different parts of education and learning, whose sole responsibility is to take ownership of this area. And because the cohort is relatively small, so we're talking usually between 200 and 300 young people of the total population of young people at our schools, it's to be done on a person by person basis, that there's clarity about where they are, what their current experience is, and what will make a difference to help improve things for them. And it is on that bit by bit, young person by young person basis that we are expecting the Promise Improvement Lead to undertake their work with this cohort of young people, and in fact be that advocate for those young people who sometimes don't have that kind of support for them. Thank you.
Thank you, that's helpful. Thank you.
Thank you, Sheila. There are no more questions, so I'm going to move this report, and in doing so, I would like to recognise the many ways in which senior leaders in our schools use this money. Sometimes they're really imaginative, and other times they're really simple but brutally effective as well. And I think it is important we recognise that work. I think that PEF and SAC and Promise monies become really crucial to lots of schools in Perth and Kinross. I can't quite figure out whether that's a good thing or a bad thing, but it is true to say that many schools consider this funding to be absolutely crucial to their everyday workings. But I think it's also appropriate to recognise, maybe even particularly at this time, dare I say, the work that are done at the front line by our support staff, and Councillor Massey alluded to that in his question, and indeed our teachers, in delivering some of the ambitions that SAC and PEF and Promise money allows us to deliver. It's one thing getting the funding, but you need people to make it happen, and I think it's important to recognise that as well. So I would like to ask Councillor Frampton to second the report, please.
Happy to second.
Thank you, Councillor Frampton. Comments, please? If there are no comments, can we agree the report? Thank you very much. I'm going to pass it on to Vice Convener Carr at this point for paper 8 on CLD, and I think Dave Stocko is here online. Thanks, Steve.
Thank you, Convener. I'd like to ask David Stocko to introduce the next paper. Thank you.
Thank you, Vice Convener. Just before I start, just an apology for not being there in person with you. I'm currently nursing a damaged foot, which is making it rather tricky to walk. So I'm afraid I'm online, but I'll do my best in the virtual world to cover this. So the introduction is as follows. The report sets out the new Community Learning Development Plan 2024-2027. Plan is statutory and is required by Education Scotland and sets out our approach to delivering CLD functions in Perth and Kinross. The plan has been written with the CLD partnership as the primary audience and is intended to be a clear and accessible document to a wide audience. The 3-year CLD plan sets out strategic aims for CLD services, which will be delivered by the partnership in order to enable better outcomes for the most vulnerable and to tackle stubborn inequalities. The Council has a statutory duty to coordinate and produce this plan. The accompanying high-level action plan is structured so that actions contributed to shared outcomes are collated across multiple services. The plan is structured using the PKC corporate priorities, also references the priorities of the Local Outcomes Improvement Plan. Progress will be measured using the performance indicators from both the corporate plan and the National CLD framework. That is something we are required to report on an annual basis. Feedback from Education Scotland on the draft plan, which is before you today, has been very positive, them confirming that the plan meets the requirements of Education Scotland and is also consistent in content and presentation with plans produced by other local authorities. I'm happy to take any questions you have. Thank you.
Thank you, David. I'd like to invite questions. First up, Councillor McPherson.
Thank you, Vice Convener. I would just like to ask, I see that the paper says a number of methods were used to consult stakeholders on the priorities for the plan. I just wonder, is it possible to have a bit more information on that? Thank you.
Yes, thanks for the question. So we developed a questionnaire which covered which was structured around the priorities for the Local Outcomes Improvement Plan. We had workshops with locality teams across Perth and Kinross, which took in services, community groups and individuals. We asked for individual feedback from partner organisations, learners and also council officers themselves who were who were delivering the plan. And we also consulted our commissioned services such as the Adult Learning Partnership and the Youth Work Partnership. So collectively, we feel we got the locality perspective and also the thematic perspective, and that's what and you see summaries of that in the strategic document. Hope that answers the question.
Yep, thank you.
Thank you, David. Councillor Massey.
Thank you, Vice Convener. Contained within the report, one of the responses you've included states that addressing poverty requires improving employment opportunities and providing access to learning and upskilling, which are essential for breaking the cycle of poverty and fostering economic empowerment. Could you give me what are the CDL functions doing about that?
Okay, thanks for the question. Yeah, that issue around poverty and employability came through quite strongly in the consultation process. So happy to say a little bit more about that. CLD, and particularly the adult provision, and I think it's the same for colleagues in youth work as well. And particularly we're working with people who are furthest away from the job market. So initially the task is to build their confidence and skills and get people actually going and maybe achieving the first qualification or certificate that they've ever had in their life. And for those people, that can be a huge achievement. Typically, our learners face multiple barriers, particularly those who are funded through the Adult Learning Partnership. So we have people with maybe long-term health issues, mental health, substance issues. So there's lots of things for them to work through, and they need a learner-centred approach to do that. And just to give an example of that, and I think actually, Councillor, you saw some of this last week at Letham Hub. So every Tuesday, we're delivering an adult learning class there, alongside the adult learning class with our colleagues from the Employability Service and also Skills Development Scotland. So those learners who are progressing, we can then hand over to other services who can then do further work with them and progress them a little bit more down that employability pipeline. So yeah, that's a flavour of what we do. So I hope that answers the question.
Thank you, David. I have a question from Councillor Duff.
Thanks, Vice Convener. On page 94, it lists some of the focuses, if you like, of the CLD activity, one of which is about volunteer development and support. One of the legacies of the COVID era, I think, was that we built up a database of volunteers, and I wonder if we've managed to continue to keep these people engaged in some way and try to develop and support them, and a bit more information on that would be helpful. Thank you.
Yeah, thanks for the question. I'll take the first bit of that, and I will ask Karen Evans, who's on the call as one of my team leaders, to say a little bit more about volunteering. So yeah, you're right. During COVID, we built up an extensive database of volunteers. What we had to do once we'd gone through COVID was contact those volunteers again and ask if they were happy for their details to be kept, because specifically we had asked for people to volunteer during COVID, so GDPR, and we had to go and just clarify that. So we did get further people who carried on and then worked in the vaccination centres, and those people and their details are also with the Health and Social Care Partnership, who run volunteer or request volunteers for the flu vaccines. Now, the Health and Social Care have maintained that list, and people do get emails asking them to volunteer opportunities. Other than that, we've not specifically used that list for volunteering, but what we have done is PCAB, we're working with PCABs, is have a new volunteer strategy and a website. And if we can just ask Karen just to perhaps say a little bit more about the development of that and how that's going.
Yeah, thank you, David. Yeah, so the Be the Change website, which I think some of you will be familiar with, was launched earlier this year. And this is a partnership, so we are funding this as part of the TSI are delivering this. And this is a platform that anybody can sign up to in Perth and Kinross. It's the first of its kind in Scotland. And basically organisations as well can put on their opportunities. So it works as a kind of a matchmaking service, so people can be matched to volunteering opportunities, or you can go on there and just browse the volunteering opportunities that are available before committing to signing up to the portal. So because that is still in its first year, we don't have any hard data yet to say how successful that's going, but we would hope to present something about that towards the end of March 2025. Okay.
Thank you. I wonder if I could just request you to share the link to that portal with members. I'd be interested in seeing it. Thank you.
Yep, absolutely.
Thank you, David, Karen and Councillor Duff, for your question. I see no more questions, so on that basis, I'm going to move the report. The community learning and development approach is based on working alongside people and communities to improve their lives. It uses both early intervention and implementing preventions to address the root cause causes of inequality. Inclusive communities need to be strong, resilient and influential in order to improve life chances for everyone through learning, employability, personal development and active citizenship. This plan will be delivered through the CLD partnership, which comprises of a wide range of public services and third sector partners. CLD is intended to provide valuable support for all individuals, children, young people, families, and especially in the communities who's experiencing some of the worst outcomes in Perth and Kinross. This is delivered through a wide range of projects and activities, including parenting classes, youth achievement awards, adult learning, community grant schemes, support for the Gypsy travelling community and those seeking refuge or asylum. This 3-year plan sets out our approach to delivering these activities and measuring achievement through performance. Committee is asked to approve the new Community Learning and Development Plan and to request that an annual update on the progress of the plan is provided following its implementation. Are we agreed? Let me ask.
Happy to formally second at this point and hope that your foot gets better, David.
Thank you. Are we happy to agree the report? Great. I'd like now to invite comments on the report. I see no comments. I'll pass back to convener.
Thank you, Vice Convener Carr. We'll move on at this stage to raise an attainment update, which will be introduced by Sheena Devlin. Thank you.
Thank you, Convener, and I'm also pleased to introduce this report to committee, which provides an update on key achievements for the academic session 23-24 in progress against the Raising Attainment Strategy, which was approved by this committee in March 2024. The report provides information on key performance measures guided by the priorities that are set out in the Scottish Government's National Improvement Framework for Education. These are improvements in numeracy and literacy attainment, closing the attainment gap between the most and least disadvantaged, improvement in the health and well-being of children and young people, and improvement in employability skills and positive destinations for all young people leaving school. Our data demonstrates improving attainment at all levels, with evidence of steady progress in aspects of closing the poverty-related attainment gap, where we compare favourably with national comparators. For health and well-being measures, exclusion rates remain on a steady downward trajectory and primary attendance is improving. But as already been referenced earlier in today's committee, secondary attendance is less positive and has remained static, but is an area of considerable focus for session 24-25. 16 to 19-year-olds' participation in positive activities has also remained static, but sits very positively in a national context. We know that there is scope for improvement in this measure. With more young people achieving national 5 and higher awards than ever before, and evidence that we are better meeting the needs of our young people with a doubling of the number of awards at National 2 and National 3 in 2024, there is clear evidence of positive progress. Never to be complacent, though, we recognise that there are always areas for improvement, and we continue to focus on those with diligence. Thank you.
Thank you, Sheena. Questions, please? Billy Ahern.
Thank you very much, and thank you for the report. My question is on the page 127, and that's the preschool development. And it's the first chance that we're getting to see the cohort of young people that were born and affected by COVID and the lockdown. And it's quite interesting to see there that some of the milestones have decreased. I'm interested in the last paragraph where it says that there is work continues across the whole of the ELC settings to mitigate the impact of these developmental concerns. And I want to know if they think that the mitigations that have been put in place are going to prevent any challenges and what the particular challenges are, but also how long do they think that the mitigations are going to need to be in place in order to bring them back into track where they would like to see them? Is it going to be sort of 1 year, 2 years, or is this going to be something that's going to be ongoing?
I think that's a good question. I think it's probably a difficult one to give a definitive answer to, but nonetheless a good question. Jill Dugan, please.
Thank you. The tracking of developmental milestones, as you know, has been in place for a number of years, and so we're looking at that very closely, not just year on year, but on a very regular basis over time. That tracking is undertaken within early learnings settings, but also children who have not met those developmental milestones continue to be tracked into primary one and beyond. And so we're keeping a very close eye on that information, and it is very difficult to say how long we need to do that, but we'll do that as long as is necessary in order to ensure that the milestones are met, and that classroom planning and delivery of learning within primary one supports that for children who are coming in. A number of supports and strategies have been put into place, including additional training in speech and language, communication champions, and enhanced support in some places within our primary one classes. We've continued some support into primary two from children who came in last year with unmet developmental milestones, and so we will just continue to do that. But as part of that overall picture of the way we deliver learning and teaching in school to meet the increasing complex needs as they present.
Thank you, Jill. Sheila?
I think the bit to add to provide a bit more surround to that is that some of the interventions and supports that are being provided need not be provided within school. So I'm thinking particularly of our parenting and family team, who are actually working directly with families, with young people, young children, on quite basic things, Bailey Ahern. So, you know, personal care, toilet training, all of these kind of things as well. And things like gross motor skills and the development of gross motor skills as well are areas that our parenting and family team are seeing that they're diversifying and being quite specific and targeting different supports to perhaps that which they've done before. And the combination of that support which is happening to families who require that as youngsters move in is helping manage and mitigate, but it's not going to be a quick fix for young people who have had significant impacts in different ways. And therefore the simple answer, as Jill said, is we just don't know how long that would be, and therefore there will be a requirement on all the professionals who work with these young people to adapt to the young people who are in front of them, rather than necessarily accept those young people to fit into what might have been expected before. Thank you.
Chris?
Thank you. And you probably just partially answered the supplementary bit there, which was the fact that this is a cohort that had a really struggle in the start to life, and not just for the young people, but also for the parents as well. And the bit there about working at home with families, and possibly too early to tell, but whether we're seeing specific problems that have occurred and attributed because of that start in life, and the start with parents starting a family in that period of time, not been necessarily having the parental support that they would have had, and having friend support because they weren't allowed to meet. And are we seeing that? But it's possibly too early to sort of see those figures until possibly a year or two's time.
Sheila?
I don't think it's too early to have seen the impact that social isolation that periods of lockdown had didn't just affect young people, but also, you know, if you're a first-time parent, particularly during those periods, then that has been incredibly challenging, and that more general support network that would have naturally been around, and a range of different people that you're able to interact with not being available, we certainly know has had an impact. I personally, and folk in my team will know that I have a particular bias around this piece of work that we have undertaken, but there's a piece of work that we have undertaken that is really, for me, a brilliant example of intergenerational work that involves exactly some of these families, parents with their children and older people in care home settings, bringing the 3 different generations together, and the impact that this has had on parents who've benefited from the wisdom and experience of some of these older people in care homes in terms of their parenting approaches, the benefit that it's had for the young people in terms of that wider interaction, and the significant benefits to the health and well-being and sense of worth of older people has been phenomenal. And so we submitted that piece of work into a national competition where it has been recognised nationally as one of importance. And we are hoping to spread that more widely across other areas of Perth and Kinross. And I think that might be something that members of the committee would be interested in finding out a bit more about. I would just advise you to bring your hankies.
Thank you, Sheila.
Just as a footnote to that, I spent the morning with elderly in a daycare centre, and that topic came up about how much they looked forward to it and they worked with it as well.
Grand. Thank you, Bailey Ahern. Councillor McPherson, please.
Thank you, Convener. My question is about literacy and numeracy. I just wonder if it's possible to have a bit more information on some of the primary school interventions that there are around literacy and numeracy. Thank you.
Jill Dugan, please.
Thank you. There are some case studies referred to within this report, and in fact the previous report, around some of the interventions. One of our most effective current literacy intervention would be within writing. We actually have 2 which are running at the moment, one which is part of a national programme, the National Improving Writing Programme, and another one about explicitly teaching writing or text types, which are both proving to have really good data behind them in terms of individual pupil attainment against their own levels of progress, against national standards, and also in terms of pupil confidence and engagement with writing, which is not always the case. And one of our target areas around that is primary 4, and we're really seeing an improvement, particularly in boys and their ability to talk about enjoyment of writing, which is really important when you're learning, as well as their attainment. Both of those are running successfully in a number of our schools, and we're into year 2 and year 3, year 2 of one and year 3 of another, and plan to roll that out further. What we're also doing is looking at how we can pull these together to just create a bigger package, if you like, of writing improvement. In terms of numeracy, there is we've referred to the use of Big Maths in one of our schools, which is a resource-led approach, but it's really about the people, the approach that they take to deliver that, and how they get engagement of the children and young people, and that's proven to be really successful. One of the other approaches that we are currently looking at and trialling in a number of places is taking what we know has worked really well with National Improving Writing and transferring that to the approach around engagement and confidence in areas of numeracy where we know that can be an issue for some children. And so that's just about really good approaches to teaching, and so it's transferable across the piece.
Thank you very much. Councillor Barrett, please.
Thank you, Convener. Just a question about page 134, the tables relating to care experienced children and young people. The other tables around here are comparing us with Scotland. This is comparing us with LAC, but I can't find any definition of what LAC is, and it's not in the acronyms list. Thank you.
David McCluskey, please.
Yeah, and apologies for the lack of clarity in that labelling. So what those tables seek to do is to compare the performance of, what's in our CMIS, our management information system, as a looked after child. So that cohort of young people against the PKC total cohort. So, excuse me, it's actually a replication, I think, of the tables we've seen in the SAC paper as well. And it's looking at that gap between our whole cohort and those care experienced children and young people who we were discussing earlier on.
Thank you, David. Thank you, Councillor Barrett. Councillor Stewart, please.
Thank you, Convener. And continuing with Councillor Barrett's theme, our care experienced pupils. And Councillor Duff highlighted graphs in previous paper. I was wondering how much of a focus is on care experienced pupils because they have complex needs and attachment issues. So it'd be interesting to know what how much of a focus are care experienced pupils in the education system. Thank you.
Fiona, please.
So our care experienced young people were referred to earlier on, and we have made quite a significant investment in terms of our promise improvement lead in terms of taking that forward. But in addition to that, we've also formed a subgroup of the Raising Attainment Board, which means that we bring together representatives from education and learning, but also from children, families and justice service, so that we're planning collaboratively for the attainment of our children, recognising how much of an impact that has on their wider life as well. So it's a very much an ongoing piece of work that we know is incredibly important.
Thank you, Fiona. Thank you, Councillor Stewart. Councillor Duff, please.
Thanks, Convener. My question is around about the case study on page 128, which is an interesting case study of a pilot at Kinross High School between January and June of this year, where iPads were distributed, and in each of the areas listed below, except for reading, which is perhaps an indication that there are still some people who like hard copy more than in computers. But in handwriting, creative writing, numeracy and maths, physical education, and the other topics there, there was significant improvement between January and May. And I wondered if we get a little bit more information about that, but also where we are in relation to the distribution of laptops for pupils within Perth and Kinross. Thank you.
I think if I can invite David McCluskey to answer the first bit of that, anyway, that'd be okay.
Yeah, absolutely. And you're right, it is a really interesting case study, isn't it? I think probably the first thing to be really clear about is that, you know, the graph there, that really refers to the engagement of these particular children and young people rather than any kind of hard attainment data that comes out of that. And that's not to negate how important that is. It's just, I suppose, about being really clear about that. And I think in terms of this particular cohort of young people, that was really important. And what the case study then begins to tease out was that the amount of time that they were able to engage with their learning really improved. What that will mean in terms of attainment outcomes will be a longer process before we're able to absolutely kind of, as I said earlier on, with fidelity to nail that down. But it has been really important. I think that, you know, this is one of a number of different pilot type projects that we have across Perth and Kinross about the impact of one-to-one devices in different circumstances, and actually in a more broad sense the impact of digital learning in all of our schools, which is in a very different place from it was 4 or 5 years ago, in a more positive place. The general comment about that would be obviously that, you know, digital learning and teaching really has to be underpinned by good learning and teaching. Digital is another tool that allows us to really, you know, reach learners in different and more engaging ways, and actually in a language that they're more used to doing. And I think, you know, the last thing is just to kind of echo something you said, Councillor Duff, which was about, you know, the reading part of this, is that it's really important that we use digital learning really intelligently. You know, just distributing devices alone will not be enough. So there's a huge amount of expertise and infrastructure that sits behind this case study and indeed the totality of digital work that we're doing. You know, and in terms of the second part of your question, I don't know if Sheena wants to answer that, or she's happy for me to take that one.
Yeah, no, I'm going to do that. I think it's a fair question, and it's one that Councillor Barrett asked in this committee a couple of years ago. Scottish Government made a commitment about this at the beginning of the parliamentary term. I suspect that Scottish Government, as well as the outgoing UK Government and as well as the incoming UK Government, have already discovered that promises that were made in good faith may not come to pass because of the fiscally challenged position we find ourselves in. And I guess in terms of laptops for every pupil in Scotland, we'll have to see where that goes. I don't know whether any of our education professionals in the room have statistics as to how many we've done already, but Sheena, I think you do. Thanks.
I think there's not a position across Perth and Kinross of one-to-one devices. That's not a policy that's been adopted. It has been in some other local authorities. It's quite interesting to understand some of the feedback from some of the early adopters, if you like, about what they would do very differently if they were starting again, because as David says, simply the distribution of devices in and of themselves does not necessarily approve attainment and achievement. And we have been working on a sort of preparedness piece, if you like, to understand about how we build the capacity and the skills of our workforce to be as digitally enabled and knowledgeable and skillful as possible, and to be discerning in the appropriate use of different technologies and different digital devices for different reasons with different cohorts at different times. And you yourself referenced that there's still sometimes a preference for books, and there absolutely is. And there is, you know, way more than a place for that learning that is not in front of a screen. What we also know are some really interesting and perhaps worrying bits of data around the impact of screen time on the eyesight of young people across the UK, where there's been a significant deterioration in terms of eyesight and a significant increase in the number of young people requiring glasses, for example. So, you know, the use of anything with a screen needs careful and thoughtful consideration to it. And we have been working away quietly in the background of that. But as to the reality of whether there'll be national funding available or not, then we understand that that is not now a commitment that will be able to be taken forward for the remainder of the duration of this Parliament.
Thank you, Sheena. Thank you, Councillor Duff. I think it does tie in as well with the conversation we had earlier on around mobile devices in schools. I think that it is related to what we're discussing, and we'll see where that goes. Thank you very much. Councillor Massey, please.
Thank you, Convener. I'm on page 140, Key Developments 2023-24, and it's the 16 plus operational group. A note from what's been written there that Dundee City Council have adopted the framework, which is really good news. What I'd like to know is how that has improved employment chances for 16 plus people.
David, please. David McCluskey.
So what the 16 plus operational group gave us was a really clear framework. And I think, you know, in the case study, you'll also see the use of the data picture there to bring all partners around the table in terms of that 16-19 picture. I suppose in education and learning, you know, we have young people until that point at which to leave school. And then, you know, we don't have direct influence over them at that stage. So it's really, really important that we're connecting with all partners who are part of that employment journey. 16-19 allowed early identification, the new framework allowed early identification of young people who were at risk of a negative destination. And the shorthand would be is, yes, we are much better at working together, and we have that forum to share that information. The challenge is always is ensuring that we get the right sustained destination for the right young person moving ahead. You know, what we tend to find is that our positive destinations when pupils first leave schools are invariably very positive, sometimes as high as 100% for individual schools. But, you know, that's not good if 3 months down the line that destination's not been sustained. So it's really, really important that we have that sustainability. Schools won't manage that themselves, and that's part of a cohesive approach, of which the local employability partnership's probably key. So a shorthand answer is yes, it has made a real positive difference. Lots more work to do, and a lot of really in-depth partnership work to get us where we need to be.
Thank you, David. Thank you, Councillor Massey. Last question from Councillor Stewart, please.
Thank you, Convener. I seem to be following on with everybody else's themes today. Following on, possibly touching on Councillor Massey's about our senior pupils and the attainment. I'm sure we'd like to know what's been done for these improvements, and what's the objective evidence about these figures? Thank you.
David, again, please.
Thanks. And Councillor, I'm taking it you're talking about the senior phase SQA results that have come through this time. Yeah. So I suppose there's a few things here. The objective evidence is what you have in front of you at the moment is our pass rate here in Perth and Kinross compared to our comparator authorities and nationally, and a bit about the overall number of passes. So that gives us evidence of clear improvement. If you take that in conjunction with the levers data that was part of the Scottish Attainment Challenge paper, whereby we're closing the poverty-related attainment gap for the number of levers with one higher, one at level 6, one higher, and one national 5, that's also a positive upward trend, as is the general picture. You know, there's ongoing work round about it because, you know, there's other things that we need to consider. So that's the macro level. So what's happening at micro level? There are differences between individual schools and settings. There are differences between individual subject departments. So we've been doing some work round about tracking and monitoring to allow a really nuanced approach for schools and actually professionals within subject departments to help each other and help themselves to drive forward that improvement, where we can identify, you know, some real strengths here within Perth and Kinross that other people can learn from. So, you know, with that, we hope to further improve not just the number of passes that we get, but the quality of passes. And I think that's going to be really crucial for us moving ahead.
Thank you, David. Thank you, Councillor Stewart. I'm going to move the paper at this point. And I think it is important to recognise that we have many challenges in our settings currently. And I think the first step to solving problems is to recognise that they're there and that there are challenges, and of course that will always be the case, and it is important that this report does realise some of those challenges, but it's also important to recognise that there have been successes. It is pleasing to note improvements in secondary school attainment, not just at Nat 5 and higher, but actually I think it's really important that we have those improvements in Nat 2, Nat 3 and Nat 4. I think that is really crucial personally. The number of vocational awards as well and the things that we're doing in that regard I think are really key also, and we touched upon the S3 construction programme, for example. I think these are really important. It's also pleasing to note an improvement in attendance levels, which we've recognised have been a problem over the last year or two. I think we also recognise that there are often very good reasons why children are not in school, particularly around challenging levels of additional support need. We recognise that, it's important to recognise that, but it's also important to recognise that when children can go to school and young people can go to school, they should be in school. Reductions and exclusions are also welcome, and it is really important to recognise the promise. I know that Councillor Shires in the previous administration was quite rightly really passionate about the promise, and I do think it is an indication of how serious that the current administration take it that we did invest in a promise improvement lead. It's really important that we don't just pay lip service to the promise, that we actually try and deliver on it. That's a difficult road, but it's one that we're determined to travel. I could go on, I won't. I will formally move the paper and ask Councillor Carr to second it, please.
Happy to second the paper.
Thanks, Councillor Carr. Comments first from Councillor Barrett, please.
Thank you, Convener. Closing the attainment gap is vitally important to the prospects of our children and young people and their families, and I fully support this Council's strong commitment to tackling inequality from birth onwards. The improvement on most counts reflected in this report is very welcome, and I'd like to thank everyone who's been involved in tackling the challenges and look forward to further progress going forward. Thank you.
Thanks, Councillor Barrett. Councillor Shires.
Thank you, Convener. Briefly, I too share Councillor Barrett's comments. I think one thing that I've observed is when you go into schools now, or when you go to parent council meetings, for example, there's much more of a kind of laser focus on attainment and on it's much more succinct reporting from head teachers about, you know, where are we where have we been, where are we now, and where are we going? And that's really welcome, and it kind of indicates the real practical on the ground, not just in a written report being submitted to us, that we see across schools, which is to be welcomed, and hopefully we can continue on that path. Thank you.
Yeah, agreed, Councillor Shires. Are we happy to agree this report? Thank you very much. We do have one paper to go, but we've been at it an hour and a half. Do we want a comfort break, or do we want to move on with the last? Move on. Thank you, everyone. The last paper is our Youth Strategy 2024. I'm delighted that Brian Hutton's been waiting patiently for us. So if Brian's here to answer any questions that we may have. No, whatever suits you, Brian. Are you introducing the report as well? Yeah, absolutely. Thanks, Brian.
Oh, that's green. Right, okay. Oh, red there. Okay, thanks. Thanks very much for inviting me along. And how heartwarming that was to hear about destinations, attainment, the promise. I just think this finishes off now about young people and voice. So I'm along here just to explain about the strategy. And I think it was Sheena that reminded me that the last time we had a youth strategy was 2003. So it's yeah, and I could see you're probably part of that actually. Kids, Andy, you were probably there. So I'm just along a bit about the youth strategy and just explaining a bit about really promoting young people's voice, especially now where the Article 12 of the UNCRC, and it's given a bit about formalisation on how we'll be working with young people as we go forward. Young people have been really at the heart of this consultation and really at the heart of developing this strategy. So we're along just to look for it being adopted and being accepted, and young people coming back to the partnership to report on the outcomes and the progress that they've made.
Thanks very much, Brian. Certainly in previous experiences when I've shared a touchline with you, it's easier when you don't have to worry about microphones. I still heard you, mind you.
Yeah, no, I agree.
Any questions from the committee, please? Sander, Provost, are you trying to master the technology there? Provost, please.
Yeah, sorry. Yes, by the sounds of it, when the last youth strategy was introduced, I was 10 years old, so things have moved on a bit. I was just wondering if you could give us a bit of an overview, because I think I'm quite a strong believer that a youth strategy should be driven by young people, and obviously the report does say that there was lots of consultation and that some of the stories were quite challenging from some of the young people about their experiences. But I think it'd just be good for the benefit of those watching online, in particular, who maybe haven't read the report, actually how this has been driven by young people and that it's shaped by them rather than those of us who are not youthful anymore.
Thanks very much. We embarked on this just as we came out of COVID, because there's a bit around young people were telling us, what was affecting them and what they would like to change. So for the last 18 months, we've had a variety of different events, bringing youngsters from all over Perth and Kinross, specifically really concentrating on the quiet voice as well, because we already know that they're all quite empowered young people out there, but it's really capturing that quiet voice as well. And what I mean by that is young carers, care experience, LGBTI, RASAC, along with our youth forums in every area. I don't know if people will understand that we've got youth forums in Crieff, Kinross, the Glens, in Perth City, and it's really looking at that scaffolding as well to support. So bringing all these groups together on a Saturday, on a Sunday, on a Wednesday evening, doing some workshops with community safety, education. Dave McCluskey was along at one session with Justice. So he's bringing a lot of partners together as well, really capturing the voice of the young people, really looking at what they were telling us, what was really affecting them. But again, you're right, Xander, we just don't go away and write that. We have to go back and check, did we get that right? You know, is this what you're really saying? And we've done that twice. So we're really looking at that. This is it. We're at this stage now. It's formalising what these young people are saying and how do we take that forward, right, at a local level. We know we've got MSYPs who do things for us on a national level, but what do we do for young people at a local level? And maybe some of the examples so far is a group from Kinross looking at safety in schools and working with the school and identifying areas and working with the school to make them look safe. The CLD plan about communities becoming more resilient, a group in Crieff looking at first aid for community groups, but not just first aid, mental health first aid, which was something new to me. They were saying we need to make communities resilient, we need to upskill communities, but not just about first aid, how we really looking, how we interacting. So they're looking at taking that forward as well. So they're coming up with some of the targets. Transport was another one. I thought, oh, what do you mean by buses? No, we're really worried about the speed cars go through our villages. You know, how do we work with that? So these are the things that young people are telling us, and these are the things that we'll be working with young people.
Thanks, Brian. Councillor McPherson, please. No problem. Thanks, Councillor McPherson. Billy Ahern.
Thank you very much, and thank you for this report. My question is on page 154 about mental well-being and the 3 statements that were on that page. And that struck me because as somebody that's been in a mental health charity for nearly 20 years, I've always been on the understanding that mental health increased in boys, but not in girls, or the fact that it was girls found it easier to mask mental health issues. But the 2 statements in there were quite specific in that the boys reported better levels of well-being to girls, and then there's an increase in problematic social media use among girls. So putting those 2 statements together, is social media, or do you think social media is having an effect on girls' mental health? And given that we've had 2 papers where we've been discussing the use of digital devices in schools, do you think that that might impact on it, the use of it? Because obviously there's people, all kids have got personal devices and they're getting younger and using those as well. And is that an issue in terms of the youth and mental health and the use of digital devices?
What we found, and this was a big thing, you know, we always thought that safety would have been in the community, you know, not just at home. And, you know, so young people are telling us, and we kept checking in. And you're right, we thought, oh, keep yourself safe on social media. A big thing coming back was young people were telling us, we can't keep ourselves safe. Okay, what you're explaining there is that sometimes it's working on relationships that are happening in the real life that's taken onto social media. So it's dealing with the real life situation rather than that going into the social media situation where, yes, people do fall out in real life, but it seems to accentuate when and becomes anonymous when it becomes online. You know, so it's taking that back and really working with young people and giving them that opportunity in the real life. You know, so I don't see it having a massive impact if we're dealing with the bits face to face.
Sheila, to add, please.
Brian's absolutely right, and I think all I would want to add to that is that through the health and wellbeing census that was undertaken in Perth and Kinross, and a survey that was undertaken a while ago by Susie's team linked to health and wellbeing as well, we were actually seeing some quite significant shifts in terms of the age group and who was reporting about how they felt about their well-being, and certainly we were seeing an uptick in relation to girls, young women, who were talking about things that were affecting them in the context of a survey that, as Brian says, that they might well have masked more generally. So there's certainly been bits of work, Bailey Ahern, that's been important for us to focus on in that regard. and the whole, you know, complicated positive force when it's used appropriately, and then really negatively impactful force around social media was actually quite a fruitful discussion, I felt, at the recent Parent Council Chairs meeting that we had, because we were talking about that in the context of mobile devices, not just mobile phones, because of course there are smart watches and other devices that people can access all manner, you know, so whatever you can get on your phone, you can probably get on a smart watch as well. So we don't just want to be talking about the use of devices or phones rather, but that wider device. But that access to social media and the impact that has had on all of society. And, you know, we can see and hear that, can't we, in our own work and our own personal lives. And if I haven't already recommended to members of this committee that, you know, a piece of reading might be a book called The Anxious Generation by Jonathan Haidt, who is an American, but who has done significant work in relation to a long-term longitudinal analysis of the impact of devices, the impact of when those devices became smart devices, who had accessibility to those and from what age, and also then the impact of things like the like and the favouriting facility, which has become a really divisive and quite cruel, actually, metric for a number of young people, and the impact on their well-being is pretty significant. And so what we have are a generation, and he takes that generation up to current 20-year-olds, because he tracks back that that's probably the first generation that at a young age, pre-10, were given a device that would have perhaps been an Android phone or a Nokia. Other simple devices were available at the time. I shouldn't just decry Nokia, but as a device that you could perhaps make a phone call or receive and make texts. And so for me, that's been one of the most salutary bits of reading I've certainly done in my professional career, I would have to say. And it's one that we are looking at that and a range of others on similar topics, and we'll be factoring that into the work that David is leading on in terms of our approach to mobile devices in schools, recognising, and committee will have heard me say this before, that if you're a primary pupil, you spend 975 hours of the year at school. There's an awful lot more hours that you're not at school that we cannot, you know, control, legislate, mitigate against. So it's a societal issue that needs a societal answer. And we always talk about it takes more than a village, doesn't it, to raise a child. And in terms of the response to the impact that social media, I mean, that horse is bolted. So again, it's a bit like the COVID situation. All we can do is manage and mitigate the impacts that we are seeing and try to think quite carefully and judiciously about any future policies in that regard. Thank you.
Thanks, Sheila. Councillor Duff.
Thanks, and thanks, Brian, for the report. I think it's very interesting and good read in terms of the style. Thanks. I wanted to talk about page 159, which talks about targeted support, and in there it talks about CASA, children alone and seeking asylum, and working with unaccompanied asylum seekers. I'm not sure how many we have now in Perth and Kinross, but there'll be a number, and I just wondered how difficult or easy you are finding the ability to engage with our asylum seeker population. Thank you.
Yeah, thanks for that question. The CASA, some of the young CASA young people actually came along to some of the consultation exercises, because it was a bit about interactive. So we really support, because the CASA part, are supported by the service I'm involved in. So we really make sure that their voice is heard, and it allows them to actually say what is affecting them rather than us assuming what would affect them. So it's giving them that voice as well. They get really good support with the English as a second language, you know, and some of them have arrived who their English is quite good, you know, so but they are involved in this as well, you know, so they come along to the consultation as well.
Thank you, Councillor Duff. Councillor McPherson, please.
Oh, thank you, Convener. My question relates to page 162 under the heading of Voice, where it says Perth and Kinross is developing a youth forum. And I note from the table below that it looks like that's not actually going to take place until September 2025. I just wondered why it is that there's such a long lead into that process. Thank you.
Thanks for that. The Voice Act's actually, you know, I think that's more of we'll come back and report in 2025 on how it's going. We've already got local youth forums, and we've had a couple of meetings with all these youth forums coming together. There is a residential that was planned for the summer, but young people are busy during the summer to take the youth forum away and do a bit of work as well. But that is in existence just now. We've got the scaffolding at a local level, and we look at representation from a local level to come together. And it happens in Perth City, you know, so that does happen.
Thanks, Councillor McPherson. Thanks, Brian. Councillor Shires, please.
Thank you, Convener. Thank you, Brian. My question is about kind of where this goes next, and it's about the involvement of partners, thinking about police and other agencies. I know that in East Perthshire we've had some real successes developing really good relationships, and we've seen sort of partnership working that's tackled issues where young people have had a real impact and involvement in that. So it was just wondering, because I noticed there's to be the creation of a strategy group. Will other partners be involved in that?
Yeah, because we're quite, what would you say, blessed by having our universal youth work partners, and at a local level they already have that partnership, you know, and they have that in Crieff as well, where the local police will pop in, you know, so they're working at that at a local level. It's good for us because, you know, we've never had this body where if we're writing about young people, can we go and present that, you know, to this youth forum? You know, this is what education's writing, this is what social work's writing, this is what services for young people are right. Can we just go and check that out? There's also a bit around is that some things come out by the police, by NHS, and it'll give them a bit of an opportunity to check out, is this youth friendly? Do young people understand that? Does this actually make sense to you? You know, and also for the youth forum, if we give it really good kudos, is them bringing partners to task, you know, and actually them evaluating their strategies. Because the part of this as well is that I see in here is that the probably a wee bit that's missing is that I didn't want to bring this back. It's young people need to bring this back to the partnership and see how well I'm doing, not how well the young people are doing. So it's that bit that we need to be looking at, and that I would say for health as well, and probably for a council, is that are we really doing that for the young people?
Thank you, Councillor Shires. There are no more questions, so I'm going to move to the report. So grab a seat, Brian. But thank you very much. I think in speaking to you, Brian, about these matters and the report in particular, there's a couple of things that kind of stick with me. That is important. I think that the strategy matches the culture, but the fact that we do have a formal strategy now for the first time in a long time, I think is a good start. I think it is important, and the questions from committee here have certainly referenced this. I think we do need to find positive ways to engage with our young people, ways that the young people are comfortable with, and not the ways that we're comfortable with. I think that's really important. And the other thing that sticks with me, and I think it's something we need to do better as a council generally, and not just in this matter, is to capture the quiet voice. I think that's really important. I think we're really good at capturing the loud voices and less good at capturing the quiet voice. And I think that's something that sticks with me. But thanks very much for your report. Your energy and enthusiasm is genuine, I know. So thanks to you and your team actually for the good work that you do. I'm going to formally move to the report and ask Councillor Frampton to second it, please.
Happy to second.
Thank you very much. Comments, please, Provost.
Thanks, convener, and thanks, Brian, for the presentation. And I think it's very much just to sort of echo what Brian was saying at the end there about it's important that it's led by young people, not just in terms of the actual formulation of the strategy, but also sort of making sure that the execution is being executed in the way they want to see it, you know, to be honest, and not the way that we find easiest, or it needs to work for them. It needs to be reflective of them. I think it is a poor show by us, as it were, that it's, you know, first one in 20 years, but I'm glad that we are here, and that we need to now keep up that momentum and not just tick the box and say we've got a youth strategy. It needs to be meaningful and also, you know, a living document in the sense that things change very fast, as we know in the last few years, and we need to be checking in that actually it remains reflective of young people's views, and you know, life changes as a young person faster than it does as an adult, so actually it may change quite often, and that needs to be okay as well. It needs to not just sit on a shelf for 6 years. So very supportive of the work that's been done, but also there is a onus on all of us to make sure that, you know, we are playing our part and ensuring that it can be delivered. So thanks very much to everyone who's been involved.
Thank you very much, Provost. The thought did occur to me when we were speaking earlier that if you're not youthful anymore, the rest of us are in trouble. But there is a seriousness to the substance of what you said there, and I couldn't agree more. It is important. It's a good step that we have a strategy. It is important to see it through and see it through seriously. So thank you for those comments. Can we agree the report? Thank you very much. I'll switch my mic back on. Just before we go, it is important to note that it's our strategic lead's last Learning and Families Committee. I'm not going to say too much, but I've been elected 7.5 years, and my brief has always been education, learning and families. So I have worked closely with Sheena in opposition for 5 years, and I was convener for 2.5 years. And it's generally speaking been a joy, and I can say that with my hand in my heart. I think it's really important when you're working as a lead, and I know Councillor Shires will speak in a minute, but I think it's important when you're working at a lead with a senior officer that there's trust in and respect for that person. And I have certainly 100% trusted in everything that you've said, and I've got oodles of respect for you. So I will miss you, and I wish you all the best in whatever comes next for you in life. Mr. Shires.
Thanks, John. I wrote some words, Sheena, because one thing I've learned from Sheena is be prepared. Just that you've been a constant figure while I've been here for 17 years. We're too young, Sheena, really. And in thinking about what to say about you, I had to really look to see what you say about yourself. And this is what I found. I am a values-driven, passionate, we're getting big ticks here, passionate senior education professional with a firm belief in social justice, and I'm committed to ensuring the provision of high quality outcomes. My natural optimism, and we try to keep that going, and tenacity are focused and balanced by an analytical and pragmatic approach to the complex challenges my team and I face on a daily basis. Oh yes, true. I think you sum yourself up pretty well there, Sheena. To that, I would add, always have a fantastic little anecdote, a purveyor of fine mugs of tea, and she can magic up a biscuit or a sweetie to get us through many a head teacher interview process. Out of nowhere, they just appear. I've seen firsthand how you deal with some really challenging situations, always with compassion, and where appropriate, a great sense of humour and an irony radar, which is second to none. Like all of us, never would you have imagined you'd have to navigate a global pandemic, which you led your service through so well, and where practical solutions came to the fore. You've also served on many national bodies with great distinction. We all know of your love of music, and I was irritated with myself that I couldn't find a suitable Michael Mara line, although perhaps Here I Am and Here I'll Stay until it's hasta la vista and I'm on my way might be appropriate. But there is a quote from Sir John Jones, which Susie Turner was trying to help me find yesterday, which every time I hear it, it sums up what so many of our staff are engaged in on a daily basis, and it is, and I had to go to Sheena to just double check I got it right. Education is the ministry of hope in the service of the young. And I'm sure wherever life takes you next, you'll take that ethos with you, and I wish you well and hope our paths cross, but maybe on the Cateran Trail, and I'll be walking while you run. Thanks, Sheena.
Thank you, Councillor Sayers. I did suggest this morning that you were better at this stuff than I am, and it turns out I was right.
It's the extra 10 years, John.
So it is. Councillor Barrett, and then I'll come to the Provost.
Thank you, convener, and thank you, Sheena. What can I say? I endorse everything I prepared to. It's okay, it's short. I endorse everything said by Councillors Rebecca and Shires, who've had the pleasure of working with you for far longer than I have. What can I say? From our youngest, from our youngest children working at Dumbarnie Primary, through leading education and children's services, and the inspiring new intergenerational work that you've championed. Thank you, Sheena. For all your service on national committees trying to improve education in Scotland for everybody. Thank you, Sheena. And for your helpful insights and encouragement to me personally. Thank you, Sheena. And I'd like to add my very best wishes for your future.
Thank you, Councillor Barrett. Provost.
Thank you, convener. And I will save most of my commentary for next week, so I have something to say next week. But from my point of view as the independent spokesperson on education for the last 7 years, it's been an interesting 7 years. You know, as I'm sure you'll agree, we've been through quite a lot as an organisation. But you leading that change through that very challenging, as Councillor Shires already noted, and indeed the convener noted as well, time, COVID, etc., where you were not just actually acting as executive director and strategic lead, but actually also as deputy chief executive at points through some of the most challenging times that we've all faced in our lifetimes. And through that, remarkably keeping a very calm, cool head, never losing the rag, and actually fundamentally you're always a teacher at heart. Every conversation we've ever had, I've always come back to that you are fundamentally always a teacher at heart. You may have been taken out of a classroom a wee while ago, but you're really just still itching to get back in there. And you certainly have never lost touch with what is going on in the classrooms. So I think it's just very fitting and appropriate that this your last committee is a learning and families one, and that we wish you all the very best for the future, and thank you very much for all of your support over the years.
Thank you very much, Provost.
You'd be surprised if I'd said no. I think convener. And I think I just heard the Provost say that he's learned some things from me over the years. That's my interpretation anyway of what he's just said. And you could, my mic's on and yours isn't, so nobody else will have heard that. But you couldn't have picked a better quote from, if you don't know the Michael Mara song that Councillor Shires referenced there, it's Frida Kahlo's Visit to the Taybridge Bar, a bar in Dundee that I'm very familiar with the inside of and have been for years and years. And interestingly, I always think about, you know that that's a reference that I go to a lot, because Michael was, in fact, I'm looking at the date, 12 years ago today, we lost Michael. And you cannot but fail to go to one of his songs to find something very appropriate in all sets of circumstances. So thank you very much for the kind words that have been shared today. I too will save some of what I'm going to say for next week at Council, as I'm sure I'll have to endure some more of this kind of thing, which I love to give out and hate to receive, to be perfectly honest. But just to quote a Michael Mara song, you know, people come and people go, and all will be well. Thank you.
Thanks everyone, much appreciated.